And former Senator Kit Bond is making news. It came out last week that he is now lobbying for the Missouri Chamber of Commerce for the Affordable Care Act. We'll get to that in a minute. Senator Kit Bond, welcome back to Big 550 KTRS.
Hey, McGraw. Good to talk with you. Let me be clear at the beginning. I'm not lobbying for the Affordable Care Act. I'm one of the strongest opponents of Obamacare, so I have absolutely no use for it.
All right. Well, that's why we got you on here. We wanted to clarify the liberal media reports out there. So, from your own mouth, exactly, Senator, what were you hired to do by the Missouri Chamber of Commerce?
I am, was, and will be a strong opponent of Obamacare. But what that did was mess up funding for our safety net health care folks, the inner city and rural health care, hospitals. Right now, the cuts are so great that with the cuts to the former federal programs, our hospitals and won't survive in many areas. The economy will be hit with drains. Our healthcare professionals will be poached by border states, and those with limited resources will either go without health care or will have to go to hospital emergency room. That's why we're fighting to reform the Medicaid program in Missouri and expand it so we can get federal funding to make up for what they have cut us.
Senator Bond, is it true that if we do not take this federal funds, I get my health insurance from the radio station? Is it true that my insurance will go up because these people who don't have insurance, who go to the emergency room, those prices and that will then be tacked on to people who do pay insurance?
That is a likely secondary impact, because when you have people who can only go to the emergency room, emergency rooms are 10 times more expensive than primary care facilities, and those costs will have to be passed on to the people who do have insurance. So it is quite likely that after a year or so, everybody who has insurance would see their premiums go up substantially, as the insurance industry has to pay the hospitals more to compensate for the care that the people who came in without any money received.
Yeah, Senator Bond, the argument in Jefferson City, many state senators and House members have said on this show that the reason why they don't want to take the federal funds is that they're afraid the government will cut off those funds and then we'll be left having to pay for those people who we've added onto the rolls.
Well, that would be very difficult to do. Because once you get into the program, now you have to fight to keep programs going, but this would be a complete about face from President Obama, and there is no indication that he's going to do that. I believe that the more likely situation for the states that do not opt into the reformed, expanded Medicaid program, they're going to get it shoved down their throats by the federal government one way or the other. So I think right now this is clearly the best path. If somehow they stick us in the future, we can either enact state law to cut it back, or even put in a trigger mechanism which brings it back if the federal government ceases funding.
What has been the reaction when you've talked to some of these elected officials in the state when you present this way to them?
Well, they're across the board. There are some people who really understand it. Senator Romines, Representative Barnes, and others are strong champions of it. They see in their areas what's happening. already with the cuts in these funds. Others are undecided, and some are outright skeptical. And we will be meeting with them to go over the facts as we see them and try to answer as many questions as we can, and see if we can't get a solid majority in both houses to pass this bill.
Senator Bond, you and I have known each other for a while. I have a great amount of respect for you. I was inches away when you pounded your fist on the podium. This is an outrage, so you and I go back quite a ways.
Oh, that was 2000. Well, it was an outrage, and thanks to the good media coverage that you and others gave us, lots of people started following up on it, and they found out how much fraud was going on in St. Louis. 25 people voting from vacant lots, and people found Ritzy Meckler, 13-year-old Springer Spaniel who was registered.
So I asked this question because I know you, and you're clearly a Republican in every way, shape, or form. You're against Obamacare, and you've certainly stated that. There are people out there who think that the reason why Missouri elected officials will not expand Medicaid is because it has President Obama's name on it, and they don't like him, so they automatically don't like anything about it, and they're cutting off their nose to spite their face.
Well, I wouldn't exactly accuse anybody of that, but let me say to anybody who is concerned about it, as part of the program, the most important thing we can do is to reform the program, make it a Missouri model program. I believe in and doing everything we can to help the needy, but not the greedy. I think that the legislature has a number of options before them. They can require co-pays. They can require managed care or other things. There are a number of conditions that have been put on Medicaid in other states, and because the federal government, Department of HHS, wants these so badly, they'll give waivers, which there's a limited window. We can get waivers and make this a Missouri program. It is not the Affordable Care Act or Obamacare. This is going to be a Missouri solution for Medicaid to take care of those in need and make sure we don't drive physicians and out of the state, shut down hospitals and primary care facilities.
So if I can say the next time somebody calls me a liberal or a whack job, I can say, hey, Kit Bond agrees with me then, because I agree with you on this.
I don't know all the things all the positions you've taken, but I certainly would never call you a whack job, McGraw, and I'll even defend some stands you may take that I believe are questionable, just because we're good friends. I'll give you the benefit of the doubt. But this one, I hope, and I appreciate your talking about it. There's a lot of confusion, but this is an opportunity for us to get out from under some of the burdens of Obamacare by taking control of our Medicaid program.
Senator Kit Bond, you are always welcome on this show, even just to stop by, and we can talk barbecue in the future. Thank you very much for your time, sir.
I'm ready for baseball.
You and me both. Senator Kit Bond, thank you very much, sir.
Thanks, McGraw.
You got it.
Bye.
There you go. Senator Kit Bond tells him why he is lobbying and been hired by the Missouri Chamber of Commerce to expand Medicaid in the state of Missouri. Interesting stuff.
Yes, he made it clear, though, he is not for...
He's not a fan of Obamacare, but he's a fan of at least one of the tenets of the Affordable Care Act. 7:58. We'll talk about that coming up in 9 o'clock.